You can't really have a conversation about healthcare today without talking about the equity of access to care. Why do you think we require law and regulation to get there?
Sure. So I think it's a couple things. So one is that you can say that, and then there's a path to get there. Mm-hmm. And when there are barriers along the path, it's easy to say, oh, well, we're not going to do that, or we can't get through that barrier. It's also easy to look at your competitors and say, well, they're probably not doing it, so we can't do that. So I look at this as sort of a floor setting exercise of making sure that, you know, there is an expectation that if you're going to be in a market in Minnesota or Colorado, that the market is going to serve our citizens and serve all of them as well as it can. And so that does take a floor setting kind of conversation, and I think it's one that I'm really excited to be having, and I know that, you know, Mike's had a lot of those kinds of conversations, but it makes it so that everybody's officially in the same boat, mm-hmm. and nobody's thinking that someone else isn't in the same boat.
So I'm hearing there that it's partially to establish what is the floor, to use your words, and to make sure that it's even, that the floor doesn't go like this. The floor is even and measurable. Is that safe?
Right. It's not like my kitchen.
I can relate to that. We'll talk later. I can relate to that more than you know.
So I think Grace is absolutely right, and it's actually what we were talking about a little bit beforehand on the competition side. Competition is fantastic for a lot of different reasons, but it can lead to some bad outcomes as well. And when we're talking about ensuring that we have an even playing field, competition can work to the opposite end of that spectrum. So I do think that regulation, Scott, to your question, comes into play very importantly in these conversations to make sure that we're meeting the goals that we all, I think, fundamentally want to meet across the board. Right? We do all want people to get the best health care that they can possibly get, and sometimes we have to, as I often say to the insurers in our market, across the board, not just health insurers, all lines of insurance. Part of my job is to help insurers get out of their own way, and that's part of this conversation too, right? Competition can quite often lead to corporate entities making bad decisions from my vantage point, making decisions that don't get to that ultimate outcome of trying to make sure that people are getting the best health care, for example, that they possibly can get. But that's where we step in and we help folks make better decisions, and that's what our job is.